today to present a new technique for impression dentistry. I call it Impress Fit. Let's take a look. I've got two cases for the same patient. One is done by an ordinary technique where I take a polyvinyl impression material and send the impression out. As you can see, these cases are untried. We have no benefit of knowing beforehand if this is going to fit or not. But you can see, looking in this box, what I had sent out was polyvinyl impression. I think in this case we had done it for a lower. Does that sound familiar in this patient over
Upper.
there? This is
I'm going to do the front teeth.
the front teeth. Yes, let me rinse this. You know what? Let me rinse this off and first try this directly on our cast. So, here's a lower cast, stone cast poured by Color Lab. Let me grab my glasses here. Sorry. As usual, they do an excellent job. The fit of the appliance to the cast is very good. So let's take this off the cast. And again, this technique the protocol was that I simply took an impression, polyvinyl, and sent it directly to Color Lab. And trying this now in the patient's mouth directly. Straight it back all the way and just aim a little towards the camera. If you want to zoom in a little, you can appreciate that this is the typical fit. That does not seat completely. Although this fits the cast, it's too tight to the patient's teeth. We'll put this aside for now. Let's direct our attention to a slightly different technique. This is a technique that I have developed. Again, I call this Impress Fit. Let's open the box. And I see we have a few buttons here, which are new to me. I didn't see this before. And some paperwork. Take a look in the box. I have not sent them the impression. The only thing they received, was a lower cast, which was poured by me in the office. All right, again, here's the appliance. We're going to try this again on the cast. Good to get a jumping off reference point and see how well it fits the cast. Here's the lower. And the MTI appliance. They usually do. I don't know if I address that off axis or not. Let's try that again. This is on the cast. Nice snap fit.
Yes.
Okay, again, this is with the Impress Fit technique. I'll rinse this off again. This should fit our patient's mouth exactly the same as the cast. And turn to the right just a little. Wow. So it's a perfect fit. Goes down a little. Beth, you take the appliance out directly. And reinsert it. All right, so that's an excellent fit. So you can see there's a difference between the two techniques. These are untried, and I just want to point out that in dentistry you have an option. You can continue doing impression dentistry the old-fashioned way, where the appliance does not fit, or you can choose to use Impress Fit. If you're a dentist, contact me. If you're a laboratory, I'd be happy to share. You may be an interested patient or individual who's had appliances that did not fit, and I'd appreciate your feedback as well. Thank you. Again, I'm Dennis White, Cranberry, New Jersey. I've utilized impression dentistry for almost 30 years, and I can promise you there's a lot of confusion within the profession. If you want impression dentistry to work for you, better outcome for porcelain veneers, partials, dentures, bridges, or implant dentistry, contact me. I can share the technique of Impress Fit. Or have your dentist contact me. Here is my contact information.